and you don't generate an insulin response because you didn't generate a serum glucose response. Okay, this all has to do with the concept of glycemic load to keep the insulin down. Okay, and that keeps you metabolically healthy because insulin's the bad guy in this story. Insulin drives chronic metabolic disease because insulin drives growth, abnormal growth. It drives vascular smooth muscle growth. That's why you get coronary artery disease. It drives prostate and breast growth. That's why you get breast and prostate cancer because of the insulin. Insulin resistance manifests different diseases. So, for instance, type 2 diabetes is a manifestation of insulin resistance at the level of the liver. Polycystic ovarian syndrome is a manifestation of insulin resistance at the ovary. Cardiovascular disease is a manifestation of insulin resistance at the heart. Alzheimer's disease, we are learning, is a manifestation of insulin resistance in the brain. So this phenomenon of insulin resistance is extraordinarily important for all of these chronic diseases, but it's regio-specific. Different tissues manifest insulin resistance at different times. And it is because of that that we end up with these different manifestations. What they said was, give all the carbs you want, just give enough insulin to cover it, which is also not true. I mean, yes, you can cover the glucose rise with insulin, but all you're doing is actually fomenting further chronic metabolic disease. So you're fixing the glucose, but the glucose isn't the problem. The insulin's the problem. And the more insulin, the quicker you die. Bottom line is, we don't need more insulin. We need insulin to work better. The point is, in any given patient, if the insulin's going up, it's a problem. And if it's going down, it's good. That's all you need to know. Within any given patient, not how the patient fares against any other patient, but within the same patient, in my view, having done this for 40 some odd years, what I say is that we need to get the insulin down any way we can.
What range? So let's talk about like what the ideal ranges should be and what to do once it starts creeping up.
Right. So ideally, the fasting insulin should be less than 10 microunits per milliliter. Ideally. The lower, the better. Okay, marathon runners who eat well will have fasting insulins of 2 or 3. I would say anything less than 10 is fine. Once you get above 15, you've got insulin resistance. That's sort of like the break point. And if you have insulin resistance, you're not going to be able to lose weight until that insulin comes down. You got to get insulin down any way you can.